We are only born once and we only die once, and to be able to make that process more comfortable and more dignified for people is very important.
All healthcare professionals will deliver palliative care at some stage in their career, from nurses, doctors and allied health working in emergency departments to residential aged care, and training really makes a difference to how that care is delivered.
This is important care. It's care that not only is important for the person who is dying, but those that are left behind. And the role of clinicians is to create that environment that facilitates that to be more of a social event rather than seen as a failed medical event.
Quality palliative care is really about decreasing suffering and empowering people to live as well as they can for the rest of their lives. And so to get education and training around palliative care, that's just so important for these vulnerable people who are dying.
Once people do it and they get comfortable with it, and particularly if they see it done well by another clinician, so that's sort of learning on the job, then they realise that actually it's not such a scary space. And what it does is it really opens up really good care opportunities for people at a very important time of their life. And so I think having training in palliative and end-of-life care is a must for all healthcare workers.
We've got a workforce shortage, and we need to really be focusing on upskilling people that everyone has capacity, and we can only do that by investing in people's knowledge development and their confidence.
In palliative and end-of-life care, there's a lot to learn for healthcare professionals to provide the care and interventions to patients that will improve their quality of life in that last phase of life. And so for that to happen, staff need support, staff need trainings.
I've seen once healthcare professionals have gone through the training, they actually have more confidence, particularly around things like communication. So how to approach a palliative care patient or a patient who's at the end of life. That sort of hands-on care that they can provide, they just do it with more confidence, which is great to see.
Palliative care training, I would absolutely say to do it. It helps you feel so much more confident, comfortable, and you do walk away feeling like you're going to be a better carer, a better nurse.
We have resources that can help health professionals identify what are my training needs as a way to get to the best training. There's lots of facilities, lots of resources, lots of education available that can help.
Every person has their own story, their own history, and they've done so many amazing things throughout their life. It's the times like now when they're the most vulnerable that they need someone to then be there to support them and return the favour. And being able to be a part of that, it's a privilege. It's amazing.